Live from Television Hill, this is WJZ News at noon.
The next 4 to 6 weeks will be the most challenging time of the entire pandemic.
Maryland hits a record high in hospitalizations. More than 3,000 people fighting COVID-19 right now. Here's a look at the numbers. Nearly 15,000 new cases reported today, and the positivity rate is now above 27%. Hello again, I'm Lynn Bowie, and welcome all of you who are streaming this noon. As you just heard, the governor says the next few weeks will be very difficult. Cases are surging across our state, and hospitalizations could reach 5,000. WJZ investigator Mike Hogan is live downtown. He has all the details from the governor and explains what this means for you. Mike, good afternoon.
Good afternoon, Lynn. Good afternoon, everybody. This should expand access to testing and alleviate some pressure on hospitals. This state of emergency is temporary, lasting 30 days.
Our projections are dramatically different than they were a week or two ago, and so we decided to take further action.
Governor Hogan says hospitalizations could reach a crisis level in Maryland, and the crucial period of the Omicron wave is now through mid-February. He signed a new state of emergency that allows quicker patient transfers and expands the number of health care providers. But the governor rejected a mask mandate.
It sometimes has an opposite effect. I mean, I'm not sure the people that are refusing to wear a mask are going to wear one anyway. We don't have the ability to enforce it, so we're just strongly encouraging people to wear the damn mask. But we don't need a mandate to force businesses to do that. We're encouraging them to do so.
Hogan says 1,000 members of the Maryland National Guard will be deployed to battle the COVID fight. 1 in 4 will help with testing, and 20 new testing sites will open outside hospitals.
We want to be additive to the community, so our overall objective is to not call up people who are also fighting COVID into civilian jobs.
Hogan called on the Biden administration to expand distribution of antiviral pills, rapid tests, and monoclonal antibodies. All of them are hard to get right now. The governor was administered monoclonal antibodies during his own recent fight with COVID.
For me, it was like a pretty bad cold, and that's because I was fully vaccinated and boosted. I'm thankful for that, so I didn't end up in the hospital or dead like so many other folks have in Maryland.
As for children, right now only 33% of 5 to 11-year-olds have been vaccinated. 12 to 15-year-olds will now be able to get boosters. The governor called for schools to stay open. The
kids are doing pretty well. I mean, we've got some outbreaks in some schools, but for the most part, they're not nearly as bad as the general population. I mean, they may be safer in school than they are, not being in school.
And overall, hospitalizations have gone up more than 500% in the past 2 months. If projections are correct, as far as hospitalizations, this will be the worst wave we've had. Reporting live downtown this noon, Mike Hogan, WJZ.
Meantime.